Most people think the only way to improve skin health is to damage it and let it heal. But what if we could actually reprogram how skin ages, heals, and inflames in the first place? Because most advanced energy-based treatments that we have in clinics like this in aesthetic medicine work through something called controlled injuries to heat and stimulate collagen remodeling and give you tightening and long-term improvements. And treatments like ultrasound tightening, lasers, and radiofrequency are excellent for improving structure and firmness by activating the body's natural repair process. But LDM ultrasound works in a completely different and complementary way at the level of cell communication, and something we now call epigenetics, which simply means influencing how our genes behave without changing DNA. In other words, teaching skin cells to function in a more youthful and healthy way. And to understand why that matters, you need to know about something inside skin cells called caveolin-1, which acts like the traffic controller of the cell controlling inflammation, collagen signaling, healing, and aging behavior. And as we age, caveolin-1 levels fall, leading to thinner skin, wrinkles, and chronic or long-term low-grade inflammation. Whilst in inflammatory skin conditions like acne, eczema, and even psoriasis, it becomes abnormally high and dysfunctional, driving ongoing inflammation. And in fact, 4 of the 6 types of psoriasis can respond well to LDM triple because of this caveolin-1 dysregulation. Now, the goal isn't to push the caveolin-1 up or down necessarily, it's to normalize it back to normal healthy levels, which is exactly what this technology does so well through mechanical cellular signaling. And alongside that, we now know the skin has its own regenerative fat layer called the dermal white adipose tissue, or DWAT, which in simple terms is a biological control layer within the skin that regulates inflammation, immunity, collagen, health, stem cell activity, and skin thickness. As we age, this layer thins and weakens, whilst in chronic skin disease it becomes dysfunctional and inflamed, and LDM triple directly stimulates this layer back into healthy function, which is why results go far beyond surface and glow and extend into real long-term skin health improvements. And this isn't just theory, because there are now over 80 peer-reviewed clinical studies on LDM technology, including randomized control trials, histological tissue studies, and long-term follow-up, showing sustained improvement in acne, other inflammatory skin conditions, dermal thickness, collagen organization, and even cellulite, many months, sometimes over a year after treatment completed from the initial course. So this is exciting because whilst LDM triple is different to more traditional ultrasound tightening treatments like HIFU or therapy, or even soft wave, which we enjoy in clinic, which primarily work through controlled thermal injury to remodel and lift tissue, whereas LDM triple uses simultaneous ultrasound frequencies to create mechanotransduction, meaning physical signals that tell cells that change behavior, switching down inflammation pathways, improving regenerative signaling, and restoring youthful cellular function. And as a doctor, that's why I see this as one of the most exciting advances in regenerative dermatology, because it works alongside traditional energy-based treatments rather than replacing them, targeting the biology of skin health itself. And if you found this helpful, make sure you subscribe, because I break down the real science behind the skin treatments without hype or myths. Drop a comment, do subscribe, and if you like this, let me know what else you want to hear on this subject or anything else to do with skin health.